The state is planning on rolling out a new coronavirus dial this week. The new dial is expected to make it easier for counties to lower restrictions. Dr. Dave Hnida is here to talk more about it. And Dr. Dave, is now the time to lower restrictions?
Well, I think like everything that we've had with COVID, there's always a little bit of uncertainty, a little bit of risk whenever there's movement done with things like dials and restrictions and mandates. I think that the state is feeling pretty optimistic that a lot of stuff is going in the right direction. We're seeing more and more people being vaccinated. We're seeing consistently low levels of COVID within the state. And at least we're not doing it like other states have done, where we just kind of flip a switch and open everything wide up. But in this particular circumstance, I think we do have some concerns about as we look at this new dial, because really with the new dial, there will be increased restaurant capacity. For example, bars have the potential to be able to reopen. We are going to just see mask mandates begin to dissolve away. And so we look at potential possibilities. What could maybe happen with these things taking place? The concerns are things such as vaccination. I mean, Colorado's done a really good job in terms of getting people vaccinated if they are in the older or at-risk groups. We still have the vast majority of our state not vaccinated yet, not fully protected, and these guidelines or dial is kicking into play well before these people will be vaccinated and protected. There's also the concern about things like variants. We don't know what's going to happen with that. We are also taking a look at things like spring break. What is going to be the result of people traveling to our state, us leaving and then coming back from other places? So there are some concerns. I think the main message or takeaway with this dial is the fact that it is a good thing, but it's important to recognize that it's not a one-way dial. In other words, it's just not set to continue to keep on improving and things continuing to reopen up. I think people need to get the mindset that we potentially could wind up having this dial go in the so-called wrong direction and need to be prepared for that. Understand that this dial is precisely that. It is a dial that moves, and it doesn't always move in the direction we want. And we need to just kind of keep an open mind that we could wind up having some relaxation and then need to pull it back.
Interesting. And here's a question I've heard a lot lately. The CDC released new guidelines saying that kids only need to be 3 feet of social distancing in school. So does that mean the rest of us no longer need to be 6 feet apart, or how does that play into it for adults as well?
It's a good question. Let's talk about the schools first, because the CDC really took a look at some studies based on schools that really, for a long time, have not had the ability to do the 6 feet distancing. They've been at 3 feet for a long time now, just because they didn't have the capacity to do so. They didn't have the room, but yet they reopened. And then it turns out that, schools really did not turn out to be, in these circumstances, basically epicenters of COVID transmission and spread in the community. And so you say, well, that's great. You can, safely go to 3 feet, but it's important to recognize that along with the 3 foot rule, so to speak, is that these schools are very strict when it comes to masking and hygiene. And it really does, when it comes to distancing, only apply to the kids, not to the so-called adults in the room. Adults, whether it be teachers, whether it be staff and so forth, are still doing the 6 feet distancing. And so you say to yourself, well, wait a second here. If we're moving things among kids, why can't we do it in society for adults, grown-ups, when we go to the grocery store, for example? I think we need to remember that transmission, contagiousness in kids is much different than it is in adults. We also have to take a look at the fact that, there was a lot of hygiene. There was mandatory masking going on in the schools. And so if you're thinking about going to the grocery store, that is something that kind of needs to enter your mindset in terms of, is there anybody that you could come in contact with that potentially does have the virus and could transmit it to you? So I think the 3 feet rule, so to speak, in schools is really a unique situation. It is for schools. It is for kids. It's being done through expediency and what is safe in that one situation. It is to get kids back into school, but it really doesn't apply to society in general.
Great. A lot of great information there. This one's interesting. A baby has been born with antibodies against COVID-19 after the baby's mother got a vaccine while pregnant. Why is that a big deal, and what kind of implications does this news have?
This is really great stuff. There have been several preliminary studies that have come out just within the last week or so that have shown that women who have been vaccinated against COVID during pregnancy wind up passing antibodies to the womb, which is just great because it would theoretically provide protection to newborn infants. The other thing is that antibodies to COVID have been found in breast milk as well. And so if you wind up being vaccinated, you potentially can pass protective antibodies along by breastfeeding. So I think when you kind of look at the big picture here, number one, the vaccines are protective for pregnant women. Pregnancy and COVID are very, very bad mix. It really can lead to very disastrous outcomes. And so, women are protected if they are vaccinated during pregnancy. Kids appear to get protection from COVID if their moms are vaccinated during pregnancy. And then there is an emphasis here again on the fact that breastfeeding does provide not just protection against things like COVID, but there are other antibodies passed through breast milk as well, therefore encouraging the use of breastfeeding after delivery. And then I think the subtle thing that gets kind of sidelined here is the fact that really, when they looked at all this stuff too, the vaccine was really shown to be safe for both mother and for baby. And that has been a huge question. Now, this doesn't automatically change the guidelines and recommendations. You still need to talk to your provider if you are pregnant or breastfeeding about getting vaccinated. But I think the tone of the discussion is going to change a little bit just because of results like this. This is great news.
Yeah, it was very interesting to hear about that. Thank you so much, Dr. Dave, for all of the great information as always. And we'll be back again next Monday at 11 a.m. to answer more COVID and vaccine questions.